To locate, it is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the third thoracic vertebra, or the T3, as illustrated in the picture. To find, first locate the spinous process of C7. From there, count down 3 spinous processes to the lower border of the spinous process of the T3. Measure 1.5 tune lateral to locate bladder 13 on the highest point of the paraspinal musculature, or with the patient seated and their arms hanging down. The spinous process of T3 is generally on the level of the medial end of the scapular line, which is to locate the bladder 13, 1.5 tune lateral to the midline. Located on the same level are DO12 on the midline, a point of extra point EXB2, 0.5 tune lateral to the midline, and bladder 42, 3 tune lateral to the midline. Sa needling, 0.5 to 1 tune obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needling retention. The needles can be secured with tape. Caution, pneumothorax. For chronic lung qi deficiency without heat signs, we use moxibustion. For the actions and indication, bladder 13 tonifies, spreads, and descends the lung qi, nourishes the lung yin. It also clears heat from the lung, releases the exterior, and opens the channel, alleviates pain. For the special features, the Back-Shu point of the lung, major point for all disorders of the lung, lung deficiency, and excess patterns. Bladder 13 point can be used in both exterior and interior patterns of the lungs. In exterior patterns, it releases the exterior by stimulating the diffusing and descending of lung qi, and thus help to expel wind cold or wind heat. In particular, it is indicated if the exterior attack is accompanied by cough. In invasions of exterior wind cold with the prevalence of wind manifested with sweating, it can regulate nutritive and defensive qi in the same way as bladder 12 Fing men. In interior patterns, it restores the descending of the lung qi and is therefore used for cough, wheezing, and breathlessness. Bladder 13 also clears interior heat from the lungs and is therefore used in acute condition of the lung characterized by heat at the qi level of the 4-level pattern identification, as may happen in acute bronchitis following an invasion of wind. The symptoms at this stage are high fever, thirst, a cough with sticky yellow sputum, breathlessness, restlessness, a rapid pulse, and a red tongue body with a thick yellow dry coating. Needled with reinforcing method or direct moxa, it tonifies lung qi and is effective for chronic deficiency of lung qi, especially if combined with DO12 Zang-Fu. When needled in this way, it also consolidates the space between the skin and muscles, and when this is too relaxed, making the person prone to invasion of external wind. Bladder 13 also nourishes lung yin, and for this purpose, it frequently combined with bladder 43 Gao-Hua-Shu. The indication desired to commit suicide must be seen in the context of the corporeal soul, Pu, which is housed in the lungs. The corporeal soul is a physical soul with centripetal movement, constantly materializing and constantly separating into different constituent aspects. The corporeal soul is in a relationship with Gui, that is ghost or spirit of dead people. Confucius said Qi is the fullness of the mind, which is the Shen. The corporeal soul, which is the Pu, is the fullness of Gui. He Xiang Gong said the turbid and the humid 5 flavors from bones, flesh, blood, vessels, and 6 passions. This Gui is called corporeal soul, which is the Hu. This is yin in character and enters and exits through the mouth and communicates with earth. The centripetal forces of Gui within the corporeal soul, constantly fragmenting, are eventually the germ of death. With regard to fragmenting, there is a resonance between the Gui and Huai, Gui with earth in front, which means pieces. Because of the connection between the corporeal soul and death, points associated with the corporeal soul, such as bladder 13, are indicated for suicidal thoughts, as we shall see below. The point bladder 42, which is on the outer bladder line, level with bladder 13, is also indicated for suicidal thoughts. So for the summary of functions, bladder 13, it stimulates the diffusing and descending of lung qi, that is for cough, wheezing, breathlessness, fullness of the chest, persistent cough in children, chest pain from the lung patterns, expectoration of phlegm. It also expels external wind, that is for aversion to cold, fever, cough, sneezing. It also regulates nutritive and defensive qi. Bladder 13 tonifies lung qi and nourishes lung yin, lung qi deficiency, consumption, steaming bones, night sweating, fever from yin deficiency, dry mouth, and throat. It also clears heat, lung abscess, rapid pus, and fever. It also calms the mind, manic behavior, desires to commit suicide. Thank you for your attention.